It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives. Changing lives. Changing lives for the better. For the better. Changing lives.
And hi again, everyone. Jim Knox along with our new host. It is Grace Sells, and we welcome you to another edition of the Best Docs Network, featuring some of the best doctors in the entire Dallas-Fort Worth area that help change people's lives. But first, Grace, we welcome you part of the Best Docs Network family, and you get to start off the show with just that, a doctor helping change people's lives.
Thank you, Jim. And that's right. Today, we're going to show you how Lisa's life was completely changed by having the gastric sleeve procedure with our first doctor. It's bariatric surgeon from My Bariatric Solutions, Dr. Scott Stowers.
At the age of 25, about 15 years ago, I was diagnosed with high blood pressure. And with that high blood pressure came 3 medications. I had a family history of heart disease and had seen a cardiologist since I was 10. Had, just a lot of weight gain with having 2 children. My grandmother had both legs amputated with diabetes. Then my father has diabetes and, just the family history.
Yeah, Lisa is an example of one of our patients that came to see me for the typical problems of inability to lose a significant amount of weight that would affect her health.
Several different doctors for 15, 20 years had been saying that, if you could lose 70 pounds and keep it off, you would get rid of the high blood pressure. There is a huge possibility that you will not be diabetic, that even your heart condition would be just almost completely resolved, and you could even get off of all of the medications. So I chose the gastric sleeve procedure, which for me was just the best choice.
For a sleeve patient, they typically need to be at least 70 pounds overweight. Sleeve is a relatively new procedure that we do where we take out about 80% of the stomach. The whole concept of the surgery is just restrictive in nature, where they essentially are on a low-calorie diet for the rest of their life, but they're not hungry all the time.
I came in, I met with the actual surgeon. I actually sat down with Dr. Stowers, and he was amazing. Somebody who just totally makes you feel comfortable. He answered every question. He was very honest with me and reassuring. It was just beyond belief that he was able to make me feel so comfortable. At 1 week post-op, I was literally off of all of my medications. It had already made that big of a difference.
Within a year, she'd lost about 80 pounds.
I've reached my goal weight. It's been great going from a size 18-20 and an extra large shirt to a size 8-10 and a medium shirt. I never thought I'd see that again, so it's been really exciting.
Aging is a multi-dimensional process which starts in the surface and involves subsurface structures, including skin, fat, muscle, and bone. So the way we determine the best treatment for anybody's aging face is by looking at the extent of aging they have in each one of those layers. The CO2 laser will address your skin surface problems like texture and fine lines and deep lines and some collagen elastin production. The radio frequency will address the skin tightness below the skin, and then you can use dermal fillers such as Radiesse or hyaluronic acid fillers to account for the loss of fat that occurs with aging as well. It is important to know what your patient needs based on their face shape and the type of aging you have. When I saw Jennifer, she originally came in asking for an option of a filler for her fine lines and deep lines above the lip and nasolabial folds. But after examining her, I determined that the CO2 fractional laser was probably the best choice for her. And she had the added advantage of having a tremendously great response to the CO2 laser by improving her elasticity.
My only knowledge of cosmetic procedures was filler and Botox. And I was told that I would probably need a facelift a few years ago by someone else, and I was dreading the thought of going under the knife, and that wasn't for me. So I was very thrilled when she told me this is basically a facelift. And sure enough, I had it 5 days ago, and I am absolutely thrilled with the results. And what's even more exciting, she says the results are even better as you go a few months down the road. So I'll continue to see improvement. I am completely blown away that for as simple of a procedure that it is, it has completely changed my life.
The response of each individual patient to these treatments is very, very different. It depends on their genetics, on their lifestyle, and so many other things, the amount of stress they may have at that time. So you cannot really have a cookbook that every patient is going to need the CO2, radiofrequency, and dermal fillers, even if they look the same at the first visit. So you really have to step back and look at their results and see how the results show up over the next several weeks before you decide to do a second treatment.
Start sprinkling your oatmeal with some cinnamon. Studies show that this antioxidant-rich spice may reduce blood pressure and lower stress.
This is Dr. David Azouz with Best Docs Network. Did you know that you can do a breast augmentation, breast lift, and a tummy tuck, also called a mommy makeover, all at the same time? If you want more information, please log on to bestdocsnetwork.com.
When a patient comes into the clinic, I want them to feel very welcome. I want to have a clinic that's a nice, warm, inviting atmosphere. I want to treat them as I would a family member, my own family member. The first person they see is Sonia. She's the receptionist, office manager, kind of the patient go-to person for any needs that they might have. She's always makes it a point to welcome every patient, make them feel invited, make them feel comfortable, and let them know that she's there for anything outside of the medical treatments that the patients might need.
We really do like to get to know our patients as much as possible on a more personal level so we can individualize their treatment plan and help them in any kind of recovery process in order for them to be pain-free and make it as smooth as possible.
The second person that a patient meets is my nurse, Kelly. She's very instrumental in the treatment process for me. And then she's very instrumental in the backside of things, and so is Sonia. Kelly's very instrumental in the post-operative or the post-treatment plans. She's pretty much the go-to person to talk to when patients have any issues whatsoever post-operatively.
Through my professional experience, I'm trained to care for all of his patients in the pre-op and the post-operative setting by providing education and what to expect during their visit, during their surgeries, and then also in their post-operative care. Initially, when I meet with Dr. Williams' patients, I review their history, their major complaints on why they've chosen to come to Dr. Williams in order to provide the absolute best information that I can for Dr. Williams to perform the surgery.
When patients come in, they may have a lot of questions about their pain and treatment options, and we are always here to answer any questions that they have.
From the moment a patient walks in my door and they meet me, I want them to understand that I'm going to take the time, do what it takes to get them from the point they are when they meet me to a point where they're 100% pain-free, no matter how long it takes.
You can request an appointment with any of our amazing doctors. Just head to our website. It's bestdocsnetwork.com, go to their profile page, and click on the Request an Appointment tab. Now, up next on the show, we're going to talk with a plastic surgeon who really values skincare as well. It's plastic surgeon Dr. Robert Wilcox.
We have a very active skincare department as part of our aesthetic practice. When patients come here, we are very proud that we can offer them either surgical rejuvenation or skincare.
I think skincare is your icing on the cake. It's going to help address whatever issues you have for tone and texture and evening out skin color.
Some people are just looking for a more youthful look. They don't really need surgery. So these different facial fillers actually enhance their face and make them look a lot younger.
That in conjunction working with Dr. Wilcox and his specialty of surgery, kind of lifting, and Vicki helping plump out and fill lines and smooth lines, the whole thing just works really well together.
Every patient is specific and every need is specific for that patient. So many of them will tell you, they'll tell you, you know, what they're looking for, and then you just kind of go from there.
Consultation entails me examining the skin, and then I can tell you what I think would be the best protocol for what you have going on, whether it's wrinkles or acne scarring or active acne or sun damage. It's usually a program of products, lasers, and chemical pills that will progress along this way to get your skin nice and pretty and glowing.
Many of my patients range from the age of 25 to 70, and I am seeing a lot more men these days. They too want to look better and enhance their appearance. They're competing a lot of times with a lot of guys that are younger than them, so they too want to look really refreshed too. These treatments stimulate collagen and slow down the aging process. They don't correct, they actually improve your overall appearance.
If we can offer either skincare or surgery, then the patients are comfortable knowing we're going to offer them the best treatment for their particular problem.
For more information and to check out hundreds of videos, head to our website. It's bestdocsnetwork.com. Now, something as simple as a smile can really brighten your day.
Exactly right, Grace, and we have just the right person that can brighten your smile. It is cosmetic dentist Dr. Guy Lewis that actually, Grace, put a smile back on one lady's face.
As I was aging, I guess, my teeth weren't as pretty as they used to be, so I found that I wasn't smiling as much as I used to.
You know, Sandy's a very beautiful lady. A lot of the patients I see, probably the majority of patients I see, are women, you know, over the age of 40, who a lot of times, you know, they take care of themselves, they stay in shape, they look great. But there's just some things they want to do to try to look younger. And for Sandy, you know, getting her teeth whiter, straightened up a little bit with the veneers was perfect for her.
I've seen a lot of Dr. Lewis's work and have been so impressed, so I came to see him. And I'm so glad I did, because now I smile all the time.
It just really works great for a lot of people, and she was a perfect candidate for that. It's amazing to me that doing the veneers like we did for her, which is a pretty simple 2-visit process, 2 or 3 weeks apart, what a difference it can make in how someone looks. I mean, and literally 10 or 15 years younger.
It's painless, it doesn't take long. Dr. Lewis is very sensitive to your feelings, how you want to look. He's a good listener. He listens to how I wanted my smile and my teeth to look, and he did exactly what I wanted.
It can be done so to where it's not like people look at you and go, wow, where'd you have your teeth done? But they look at you and go, man, you look great. You know, what have you done? Have you been working out more? Or you just look, for some people, if their teeth are really bad, yeah, it's going to be a noticeable change. But for other people, it's just one of those things to where you just look good, you look more alive, you look more refreshed, you just look better, but it's not just a glaring, oh, what'd you do to your teeth, you know?
My family would say, okay, what did you do? Something's different. Your smile is beautiful. Did you get your hair cut? I just feel so good about my smile now. Smiling's good. I'm not a big fan of going to the dentist, so this was a big deal for me, and I would do it again in a heartbeat.
The Best Docs Network is all about doctors helping change people's lives. It's educational, informative, and real. Log on to bestdocsnetwork.com.
I didn't have Poland syndrome, but it was like it, where one breast is significantly bigger than the other. So I was like a B and a C. It affects everything. The way you dress, the way your wardrobe is, things you can and can't buy. And as a woman, you want to be able to just go buy it because you like it and you want to wear it, not because of the way it's shaped or formed around your breast area. I just got tired of feeling like that, and I knew that after having a child, it still didn't change. I finally said enough is enough, and I went and saw Dr. Barnett.
Kayla was a special case. This was actually more of a reconstruction than it was simple augmentation. There was nothing simple about that case. She had vast asymmetry in the breast. Asymmetry means one's not the same size or shape as the other. In Kayla's case, this one never developed. And this one was what you'd call a tube sock, elongated, hanging down. This one was barely there. Usually should have been a two-stage operation. And I told her going in that, I can do so much, but probably you're going to need another operation.
We talked about it and looked at the pictures, and the kind of surgery I needed and required with what I had should have been a two-step, possibly three-step operation. And what Dr. Barnett did was just a one-step operation. And that's all it took.
I was able to, in one stage, create a matched pair. It worked out beautifully. It's been a year now, and she looks fabulous, and she's happy as a clam. Is it rewarding? Yeah, really is. That's a special case.
Dr. Barnett treats his patients like family. He will give you his cell phone number to make sure that you can always be in contact with him if you ever need anything before and after surgery. I'm happy and glad to know that I safely chose him. I've had no complications. You can't even see my scars. He changed my life forever. It was the best decision I ever made.
Welcome back to the Best Docs Network. In the studio, we're pleased to be joined today by Dr. Harvey Carter, owner and founder of Carter Eye Center and one of the top cataract surgeons, not only in the Dallas-Fort Worth area, but in the country. Dr. Carter, thanks for being with us today.
Thank you for having me.
Now, you were the first doctor in the United States to perform the crystal lens procedure once it was approved by the FDA. Can you talk us through the procedure and how it works?
The crystal lens procedure is where you do a cataract implant operation, and cataract implant surgery is done with an implant lens where we replace the cataractus cloudy lens in the human eye with this implant lens. The crystal lens allows the patient to develop a wider range of vision after surgery because the lens is the only lens approved by the FDA to accommodate or focus in the human eye, which gives you the widest range of vision from near, far, intermediate in terms of a range of vision, allowing the patient to get some degree of spectacle freedom.
At what age do you normally see cataracts forming?
I'd say roughly 2 out of every 3 patients over the age of 60 have some degree of cataract development in their eye. The average age of the roughly 3.5 million or so patients who had surgery in the United States last year was probably around 72 years of age. So it's a painless, progressive, gradual loss of vision over about a decade or so is when patients start to notice it. The first signs and symptoms will be things like glare, halo, difficulty night driving, inability to see the television, different activities of daily living that'll just start to become impaired as you get into your 50s, 60s, 70s.
And do I understand correctly that you don't necessarily have to have a cataract to be a candidate?
Well, that is true. If you take and look at the operation, cataract implant surgery, which is where this came from, involved taking the cataract out and putting in this monofocal lens implant. And that's the most popular #1 procedure.
To see the rest of this interview, as well as other outstanding videos, head to bestdocsnetwork.com.
You hear a lot about probiotics nowadays. A lot of people take probiotics. In some cases that's good, in some cases it's not going to help much. Probiotics are microorganisms that people take and it gets in their intestines and populates their colon with the good kind of bacteria, like the lactobacillus, for example. There are lots of different kinds of probiotics, and in general, people that are healthy and are having no gastrointestinal symptoms don't need them. However, if you've had a lot of diarrhea, let's say you have a lot of gas, either from the upper end or the lower end, or let's say you just have a lot of bloating and feel bad, probiotics may help you. Don't get the expensive brand name stuff over the counter, get the cheap stuff. Yogurt may work sometimes, but generally the probiotics that are over the counter are more concentrated than the yogurt. And it does repopulate your colon with the right bacteria and can help you with everything from gaseousness to diarrhea. That's a crowd pleaser. Go ahead and take it, it might help you.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com and click on the Medical Minute tab on the home page.
Don't forget, for more information about any of our outstanding doctors, even request an appointment, head to the website, bestdocsnetwork.com. That is bestdocsnetwork.com. Speaking of best, our next doctor, one of the best plastic surgeons in the entire Dallas-Fort Worth area. It's Dr. David Azouz, who gave one lady a new look.
Edith was looking to reduce her contouring in many places and just improve her total body contouring. She had a lot of difficulty losing weight, and she knew she wanted to get rid of pockets of fat on her abdomen, her saddlebags, her inner thighs, her knees. So she wanted to have almost total body liposuction.
I guess you could say I was unhappy with myself, so I felt like it was going to take me forever to lose the weight. So I just felt like a liposuction was going to help me to kind of get me where I needed to. And Dr. Azouz told me I wasn't going to lose a ton of weight, but it was going to help me to see a big difference in my waist. But of course, I need to still continue to try to lose a lot of weight.
Edith didn't like her body habitus, and she didn't like the fact that she was heavy in the thigh area, the abdominal area. She didn't like her upper arms. In all these areas, she wanted to reduce the pockets of fat and have more definition. She still wanted to look very natural. She wasn't looking to look overly thin. She just wanted to have a total better contouring of her body. The beauty is once you have liposuction and you start to look so good, then you feel motivated to exercise, eat properly, and you look better and better. And Edith was able to achieve all those things with the surgery.
It's just changed my ways of how to just feel more confident in getting in the gym and just exercising and just eating better, and it's really made me extremely happy that I could get back to some of my clothes that I couldn't fit the last couple of years. Dr. Azouz makes you really feel comfortable. He wants you to make sure that you understand everything you're gonna go through. He's there for you, and you know, you just gotta have a good support team after your surgery, and he's there at all times.
I'm honored to have a patient that I can help. I think it's an honor to be able to share this gift with a patient. And for many of these patients, this achieves results that they could only think of in their dreams. And then they have the results that they've always wanted. So naturally, it gives me pleasure to be able to make people happy like that.
Drink green tea. It's packed with heart-boosting and cancer-stopping polyphenols that black tea doesn't offer. Green tea also delivers a boost of alertness, but from a smaller dose of caffeine than black tea.
I never had an experience as I had with any of the other MRIs I've had over my lifetime. I came here and I thought I was back at my own house, and the people were so welcoming and caring. What did I need that was extra? Was I comfortable? And I was... concerned with my state after the MRI was finished. So they have chocolate cookies, they have candy, they have whatever you want, water, so forth and so on. Sit down and wait and rest. This is unusual for me as a patient. I'm really happy that the doctor and the radiologist found some specifics that made my procedures less than they would have been and much easier for everybody. So I'm very appreciative of Preferred Imaging and its staff.
Having that peace of mind was very important because once I found out that I was going to stay off for just some time and I realized it wasn't like a rupture or something like really severe, that really like kind of eased the burden within me, and then I kind of can project and have a game plan as far as when I want to get back out there and start working out again and running. Gave me a lot of peace of mind.
Hi, this is Dr. Malik. Did you know that there are many new non-surgical treatment options for aging skin? For more information, head to bestdocsnetwork.com.
We're very excited about having the MLS laser treatment in our office. It's a class 4 laser. It's one of the strongest lasers, non-invasive lasers on the market. What makes this laser unique is it has a dual wavelength system in it.
I began experiencing severe burning on the inside part of my ankle. The bottom of my feet were burning to where it felt like I was walking on hot coals, and I could not walk at a normal pace.
Basically, what makes this laser unique is it has a dual wavelength system in it. What it's doing is it's penetrating through the damaged tissue, and it is triggering a metabolic reaction on a cellular level, which promotes healing.
I just wanted to be able to walk down the street and not feel pain.
Jamie has experienced pain for years. She had a chronic tarsal tunnel syndrome in conjunction with chronic plantar fasciitis. We had done surgery on one of her feet a couple of years ago, and she had had reduction in pain but not complete relief of her symptoms.
Dr. Holcombe came to me and said, you know, we're going to get this laser therapy and I really want to try it on you. So I was gung-ho for it. I said, why not? You know, it's been over 3 years, 4 years that I've been dealing with this. I'm 2 surgeries. I'm ready to try anything.
The laser technology is truly revolutionary. It's like a magic wand that all physicians wish they had.
After the first therapy, I could tell a difference. I was able to walk across the room and I wasn't limping.
If you have a technology that is non-invasive and has no side effects, no downtime, and it can help prevent you from having surgery or reduce chronic pain, you know, or even eliminate or reduce your medication, why not try it?
I recommend Dr. Holcombe to everybody I know, and I am always telling them to come see Dr. Holcombe. I would recommend this office to anybody that was dealing with any kind of foot pain. They have been phenomenal for me, and I'm forever grateful.
That'll do it. That'll wrap up another edition of the Best Docs Network, which of course features some of the best doctors in the entire Dallas-Fort Worth area that help change people's lives. And the good news is, Grace, for more information about any of our outstanding doctors, you can go to the website, bestdocsnetwork.com. That's bestdocsnetwork.com.
And if you have a question or comment or a life-changing story, we would love to hear from you. Just send us an email at info@bestdocsnetwork.com.
So long, everyone. We will see you next week.